In our course today for the Vision Expo, Dr. Sheila Morrison and I discussed some of the behavioral modifications that can be useful to recommend to parents and families when dealing with screens. So definitely breaks from screens is always recommended. We know though that there are going to be things that kids are expected to do on their devices. And we do see in the literature that when it comes to myopia, there's really no difference in the risk looking at a screen with a light versus a book that you're flipping the pages. Those near tasks, they both have a role. And one of the things that is very easy to educate families on is arm's distance away minimum. Also, when we're having certain activities done on screens and devices, whenever possible, if you could shift that out to a larger screen, maybe put it on a monitor that's further away. Those are things that are very easy in many cases to do for families that can kind of reduce the number of hours spent on devices that are very close. Now, when it comes to dry eye and ocular comfort, we talked a little in our lecture about how there is a difference between, say, a book that you flip the pages versus a screen with the backlit lighting. There is a difference in our blink rate and how we feel after we use a device that's on a screen versus a book. It is something to be mindful of. The thing that stands out the most for me when it comes to looking at treating pediatric patients, we need more research, we need more attention to it, is preventative care. And that is in all facets of what we do, myopia, dry eye, anything that we're doing for kids really could have more of a focus on prevention than reaction. Kids are presenting at earlier ages to the dry eye clinic, and not because they're complaining. That's the tricky thing about children is they often won't complain unless they actually have a true red eye or a complication that's probably exacerbated by a device that we use, like a contact lens that makes them feel more uncomfortable than they were before. What we see in the clinic at earlier ages are actually those signs. So studies have shown for a number of years now, and I do see this in the clinic as well, that things like meibomian gland loss is actually higher in younger children. If you actually take the time to measure it, you'll see that teenagers are presenting with more meibomian gland loss than many adults. And that's a really scary thing to see in the clinic, because if you think about decades in the future for these kids that already have meibomian gland loss or dry eye signs, they are certainly on track to becoming symptomatic at a younger age. And by the time they're in their 50s, 60s, 70s, who knows what the status could be if we don't intervene. So the number one thing that I would advise when we're looking to see if we have an issue with a treatment being effective or lens fitting well versus non-compliant solutions being misused, every time that somebody comes in your clinic, ask them what they're doing in their routine related to their dry eye plan. Ask them what solutions they're using with their contact lenses and how are they using them. And you'd be surprised, or maybe not so surprised, at how many things can actually be lost over time, even in patients that have been doing a certain treatment for a number of years. I do find there's a big transition also with kids when they're really small. The parents are very on it, almost helicopter. I'm guilty of that too. I mean, my kid's 8, and we are very attuned into what their little routines are and always supervising. As kids go from that age of maybe 8, 9, 10 into 14, 15, 16, parents are more hands-off, and that can actually be a space where even though kids will have all the best intentions and are willing and coachable, things do get forgotten, and it is important to continue to ask every visit what they're doing and how they're doing it. Just talk about it all the time. Don't assume that something is going the way you think it is. When there's a problem, I always blame solutions first, blame the handling first until proven otherwise. I learned that very early on when it comes to contact lens especially, that solutions can really play a primary role in success or failure. And so because that is such a big part of the dry eye clinic and the myopia clinic, both are intertwined in contact lenses, that we have to make sure that we're using solutions appropriately.